Counseling, meaning, nature, and scope of counseling. First question of this video is which of the following best describes the primary goal of counseling? Option: providing advice and solution to clients, diagnosing mental health disorders, facilitating self understanding and personal growth, prescribing medication for psychological issues. Answer of this question is option C, that is facilitating self understanding and personal growth. Next, the term counseling is derived from the Latin word consilium, Consilium, which means option to heal, to advise, to teach, to empathize. Answer of this question is option B, that is to advise. Which theoretical approach to counseling emphasizes the importance of unconscious processes and early childhood experiences? Option: cognitive behavioral therapy, person centered therapy, psychoanalytic therapy, existential therapy. Answer of this question is option C, that is psychoanalytic therapy. In counseling, the concept of unconditional positive regard is most closely associated with option Albert Ellis, Sigmund Freud, Carl Rogers, Aaron Peck. Answer of this question is option C, that is Carl Rogers. Next, which of the following is not typically considered one of the core conditions for effective counseling as proposed by Carl Rogers? Option: empathy, congruence, unconditional positive regard, interpretation. Answer of this question is option D, that is interpretation. The working alliance in counseling refers to option the professional relationship between counselor and supervisor, the collaborative relationship between counselor and client, the therapeutic technique used in sessions, the counselor's theoretical orientations. Answer of this question is option B, that is the collaborative relationship between counselor and client. Which ethical principle in counseling emphasizes the importance of non-causing harm to clients? Option: beneficence, non-maleficence, autonomy, justice. Answer of this question is option B, that is non-maleficence. The concept of transference in counseling refers to option the counselor's emotional reaction to the client, the client's unconscious redirection of feeling from past relationship onto the counselor, the process of transferring skill learned in counseling to real life situation, the transfer of confidential information between professionals. Answer of this question is option B, that is the client's unconscious redirection of feelings from past relationships onto the counselor. Answer of next question is which of the following is not a typical stage in the counseling process? Option: assessment, goal setting, intervention, diagnosis. Answer of this question is option D, that is diagnosis. The nature of counseling is best described as option a one-way process of giving advice, a collaborative, goal-oriented process, a medical treatment for mental disorders, a spiritual guidance practice. Answer of this question is option B, that is a collaborative, goal-oriented process. Which of the following best describes the scope of counseling? Option: limited to treating severe mental illnesses, focused solely on career guidance, encompassing various aspects of human development and well-being, restricted to childhood and adolescent issues. Answer of this question is option C, that is encompassing various aspects of human development and well-being. Next, the principle of confidentiality in counseling means that all information shared by the client must be kept secret under all circumstances. Information can be shared freely with the client's family members, Information is kept private with certain ethical and legal expectation. Only written records need to keep confidential. Answer of this question is option C. That is, information is kept private with certain ethical and legal acceptation. Which of the following is not typically considered a counseling specialty? Option: marriage and family therapy, school counseling, pharmacology, substance abuse counseling. Answer of this question is option C, that is pharmacology. The concept of multicultural competence in counseling refers to option: the ability to speak multiple languages, knowledge and skill for working with diverse population, specializing in international counseling, focusing solely on cultural minorities. Answer of this question is option B, that is knowledge and skills for working with diverse populations. Which statement best describes the relationship between counseling and psychotherapy? Option: they are completely distinct fields with no overlap. Counseling is a subset of psychotherapy. Psychotherapy is a subset of counseling. There are overlapping fields with some distinctions in focus and approach. Answer of this question is option D. That is, there are overlapping fields with some distinctions in focus and approach. The person-centered approach to counseling emphasizes option: changing maladaptive thought and behaviors, exploring unconscious conflicts, the client's innate capacity for growth and self-actualization, prescribing medication for symptom relief. Answer of this question is option C, that is the client's innate capacity for growth and self-actualization. Which of the following not a common setting for counseling practice? Option: schools, hospitals, private practice, law enforcement agencies. Answer of this question is option D, that is law enforcement agency. The term therapeutic alliance in counseling refers to option: a formal contract between counselor and client, the bond and collaborative working relationship between counselor and client, an alliance between different therapeutic approaches, a medications regimen agreed upon by counselor and client. Answer of this question is option B, that is the bond and collaborative working relationship between counselor and client. Which of the following best describes the role of counselor? Option: to provide expert advice and solution for all client problems, to facilitate the client's own process of self-discovery and problem solving, to diagnose and treat mental illness exclusively, to act as a friend and confidant to the client. Answer of this question is option B, that is to facilitate the client own process of self-discovery and problem solving. The concept of boundaries in counseling refers to option: the physical layout of counseling room, the time limit of each session, the ethical and professional limits that define the counseling relationship, the tops that the topics that are off limit in counseling discussion. Answer of this question is option C, that is the ethical and professional limits that define the counseling relationship. Which of the following is not a combination theoretical orientation in counseling? Which of the following is not a common theoretical orientation in counseling? Option: cognitive behavioral therapy, psychodynamic therapy, humanistic therapy, pharmaceutical therapy. Answer of this question is option D, that is pharmaceutical therapy. The concept of counter transference in counseling refers to option: the client's resistance to change, the counselor's emotional reaction to the client, the transfer of skill from counseling to real life, the client's progress in therapy. Answer of this question is option B, that is the counselor emotional reaction to the client. Which ethical principle in counseling emphasizes respect for the client's right to make their own decisions. Option beneficence, non-maleficence, autonomy, justice. Answer of this question is option C, that is autonomy. The ecological system theory in counseling developed by Uri von Federens focused on option environmental conservation in therapy setting, the impact of various environmental systems on an individual's development, the use of nature-based therapies, the biological basis of mental health. Answer of this question is option B, that is the impact of various environmental systems on an individual's development. Which of the following is not typically considered core counseling skill? Option active listening, empathy, confrontation, diagnosis. Answer of this question is option D, that is diagnosis. The term unconditional positive regard in counseling means option agreeing with everything the client says, accepting the client without judgment regardless of their action of or words, providing constant praise to the client, avoiding any form of criticism in therapy. Answer of this question is option B, that is accepting the client without judgment regardless of their action or words. Which of the following best describe the differences between counseling and clinical psychology? Option counseling focuses on wellness while clinical psychology focuses on mental illness. Counseling is short term while clinical psychology is always long term. Counseling is non scientific while clinical psychology is scientific. Counseling is for adult only while clinical psychology is for all ages. Answer of this question is option A, that is counseling focuses on wellness while clinical psychology focuses on mental illness. The concept of mindfulness in counseling oriented from option Western psychological theories, Eastern philosophical tradition, neuroscientific research, behavioral psychology. Answer of this question is option B, that is Eastern philosophical tradition. Which of the following is not a typical goal of career counseling? Option assessing interest and aptitudes, providing information about various career paths, diagnosing mental health disorders, developing job search skills. Answer of this question is option C, that is diagnosing mental health disorders. The term resistance in counseling refers to option the client's deliberate attempt to sabotage therapy, the counselor's dislike of the client, unconscious or conscious processes that interfere with progress in therapy, the client's physical resistance to medication. Answer of this question is option C, that is unconscious or conscious processes that interfere with progress in therapy. Which of the following is a key principle of solution focused briefly therapy? Brief therapy. Option extensive exploration of past traumas, focus on a client's strength and resources, long term treatment plans, emphasis on psychiatric diagnosis. Answer of this question is option B, that is focus on a client's strength and resources. The concept of self actualization is most closely associated with which theoretical approach? Option psychoanalytic, cognitive behavioral, humanistic, behavioristic. Answer of this question is option C, that is humanistic. Which of the following is not typically considered a form of group counseling? Option support groups, psycho-educational group, therapy group, social media group. Answer of this question is option D, that is social media groups. The term therapeutic ruptures in counseling refers to option a break in the counseling relationship due to a misunderstanding or conflict, the end of the counseling process, a breakthrough in the client's understanding, a counselor vacation time. Answer of this question is option A, that is a break in counseling relationship due to a misunderstanding or conflict. Which of the following best describes the role of assessment in counseling? Option: to diagnose mental disorders, to gather information about client situation, concerns and goals, to determine the client's IQ, to predict the client's future behavior. Answer of this question is option B, that is to gather information about the client's situation, concerns and goals. The concept of unconditional positive regard is most closely associated with Sigmund Freud, Carl Rogers, Aaron Flench, Albert Bandura. Answer of this question is option B, that is Carl Rogers. Which of the following is not a typical ethical concern in online counseling? Option: confidentiality of electronic communications, crisis management and remote setting, li- licensure across jurisdictions, the counselor's office decor. Answer of this question is option D, that is the counselor's office decor. The term evidence based practice in counseling refers to option: using only techniques that have been scientifically proven effective, relying solely on the counselor's personal experience, integrating the best available research with clinical expertise and client values, focusing exclusively on measurable outcomes. Answer of this question is option C, that is integrating the best available research with clinical expertise and client values. The concept of multicultural counseling competencies include which of the following? Option: awareness of one's own cultural values and biases, knowledge of diverse cultural worldviews, skills in working with diverse population, all of the above. Answer of this question is option D, that is all of the above. Which of the following best describes the difference between counseling and advice giving? Option: counseling is always free, while advice giving is paid. Counseling facilitates client self discovery, while advice giving provides direct solution. Counseling is only for mental health issues, while advice giving is for practical problems. Counseling is long term, while advice giving is always brief. Answer of this question is option B, that is counseling facilitates clients self discovery, while advice given provides direct solution. Next, the concept of self-efficacy in counseling developed by Albert Bandura refers to option: the client's ability to pay the therapy, the counselor confidence in their skills, an individual's belief in their ability to succeed in specific situation, the effectiveness of self-help books. Answer of this question is option C, and that is an individual's belief in their ability to succeed in specific situation. Which of the following is not a typical form of counseling intervention? Option: cognitive restructuring, exposure therapy, motivational interventions, pharmaceutical prescription. Answer of this question is option D, that is pharmaceutical prescription. The term therapeutic alliance is most closely related to which factor in counseling outcomes? Option: the counselor level of education, the specific technique used, the quality of counselor client relationship, the duration of therapy. Answer of this question is option C, that is the quality of counselor client relationship. Which of the following best describes the concept of school counseling? Option: exclusively focus on academic achievement, limited to behavioral problems in the classroom, encompassing academic, career, and personal social development, primarily dealing with learning disability. Answer of this question is option C, that is encompassing academic, career, and personal social development. The concept of microaggressions in multicultural counseling refers to option: aggressive behavior exhibited by client, subtle, often unintentional, discriminatory comment or action, minor disagreement between counselor and client, small scale trauma experiences. Answer of this question is option B, that is subtle, often unintentional, discriminatory comments or actions. The term dual relationship in counseling ethics refers to option working with two clients simultaneously, having both a professional and personal relationship with a client, using two different therapeutic approaches, consulting with another professional about a client. Answer of this question is option B, that is having both a professional and personal relationship with a client. Which of the following best describes the primary focus of existential therapy? Option changing negative thought patterns, exploring unconscious conflict, addressing issues of meaning, purpose, and human existence, modifying maladaptive behavior. Answer of this question is option C, that is addressing issues of meaning, purpose, and human existence. The concept of scaffolding in developmental counseling refers to option building a physical structure during therapy, providing temporary support to help clients develop new skills, a technique for treating fear of heights, constructing a treatment plan. Answer of this question is option B, that is providing temporary support to help clients develop new skills. Which of the following is not a typical ethical principle in counseling? Option beneficence, null maleficence, fidelity, profitability. Answer of this question is option D, that is profitability. The terms intersectionality in multicultural counseling refers to option the intersection of different routes where counseling takes place, the overlapping and interdependent system of discrimination or disadvantage, the point where different therapeutic approaches meet, the intersection of the counselors and client backgrounds. Answer of this question is option B, that is the overlapping and interdependent system of discrimination or disadvantage. Which of the following best describes the difference between empathy and sympathy in counseling? Option empathy involves feeling sorry for the client, while sympathy involves understanding their perspective. Empathy involves understanding the client's perspective, while sympathy involves feeling sorry for them. Empathy is technique, while sympathy is an emotion. There is no difference. The terms are interchangeable. Answer of this question is option B. That is, empathy involves understanding the client perspective, while sympathy involves feeling sorry for them. Which of the following is not a typical goal of grief counseling? Option helping clients process their emotion, supporting clients in adjusting to life without the decreased, encouraging clients to forget about their loss, assisting clients in finding meaning in their experience. Answer of this question is option C, that is encouraging clients to forget about their loss. Which of the following best describes the primary focus of solution focused brief therapy? Option extensive exploration of past experiences, identification and amplification of expectation to the problem, long term personality restructuring, in depth analysis of unconscious motivations. Answer of this question is option B, that is identification and amplification of expectation to the problem. The concept of cultural encapsulation in counseling refers to option the process of preserving cultural artifacts, A counselor's tendency to view things solely from their own cultural perspective, a client's strong identification with their culture, the encapsulation of cultural norms in therapy. Answer of this question is option B, that is a counselor's tendency to view things solely from their own cultural perspectives. Next, the term resistance in psychodynamic counseling is most closely associated with option client's refusal to pay for sessions, counselor dislike of the client, unconscious forces opposing the progress of the therapy, physical resistance to medication. Answer of this question is option C, that is unconscious forces opposing the progress of the therapy. Which of the following best describe the concept of congruence in person-centered therapy? Option: the alignment of the counselor's inner experience with their outward behavior. The matching of client's goal with the counselor technique. The consistency of client's behavior across different situations. The agreement between the counselor and client on the diagnosis. Answer of this question is option A, that is the alignment of counselors' inner experience with their outward behavior. The term therapeutic rupture in counseling refers to option a break in counseling relationship between two misunderstanding or conflict. The termination of counseling, a breakthrough in the client's understanding, the counselor's decision to change theoretical approaches. Answer of this question is option A. There is a break in the counseling relationship due to a misunderstanding or conflict. Which of the following is not a typical consideration, a common factor in effective counseling across different approaches? Option: therapeutic alliance, empathy, client expectation, specific technique unique to each approach. Answer of the question is option D. There is specific techniques unique to each approach. The concept of mindfulness in counseling is most closely associated with which approach? Option: psychoanalytic theory, cognitive behavioral therapy, dialectical behavioral therapy, psychodynamic therapy. Answer of this question is option C, that is dialectical behavioral therapy. Which of the following best describes the primary goal of vocational counseling? Option: treating mental health disorders, assisting clients in making informed career decisions, improving family relationships, prescribing medication for work related stress. Answer of this question is option B, that is assisting clients in making informed career decisions. Next, the term transference in psychodynamic counseling refers to option the transfer of skills from the counselor to the client's unconscious redirection of feeling from past relationship into the counselor, the transfer of confidential information between professionals, the process of changing therapeutic approaches. Answer of this question is option B, that is the client's unconscious redirection of feelings from past relationship onto the counselor. Which of the following is not a typical ethical consideration in the group counseling? Option: confidentiality among group member, managing group dynamics, ensure equal participation from all members, prescribing medication group, to group members. Answer of this question is option D, that is prescribing medication to group members. The concept of scaling question is most closely associated with which counseling approach? Option: psychoanalytic therapy, cognitive behavioral therapy, solution focused brief therapy, gestalt therapy. Answer of this question is option C, that is solution focused brief therapy. Which of the following best describe the primary focus of narrative therapy? Option: changing negative thought pattern, exploring unconscious conflict, re-authoring personal stories and meaning, modifying maladaptive behavior. Answer of this question is option C, that is reauthoring personal storage and meaning. The term unconditional positive regard, I think this I already covered so many times. Which of the following not typically considered a stage in the counseling process? Option: building rapport, assessment, goal setting, medication engagement. Answer of this question is option D, that is medication engagement or management. The concept of self disclosure in counseling refers to: option: the client revealing personal information, the client sharing personal experiences or feeling, the process of uncovering unconscious material, the revelation of confidential information to third parties. Answer of this question is option B, that is the counselor sharing personal experiences or feeling. Which of the following best describe the difference between counseling and psychotherapy? Option: counseling is always short term while psychotherapy is always long term. Focusing Counseling focuses on specific problems while psychotherapy addresses deeper issues. Counseling is non-medical while psychotherapy is always medical. There is no significant difference. The terms are often used interchangeably. Answer of this question is option D, that is there is no significant difference. The terms are often used interchangeably. Next, the concept of counterference in counseling refers to. Answer of this question: the counselor's emotion reaction to the client. This is already discussed. Which of the following is not a typical goal of group couple counseling? Option: improving communication, resolving conflict, enhancing intimacy, encouraging separation. Answer of this question is option D, that is encouraging separation. The term active listening in counseling involves: option: giving advice quickly, finishing the client's sentence, fully attending to, to end reflecting the client's communication, interruption the client to offer solution. Answer of this question is option C, that is fully attending and reflecting the client's communication. Which of the following best describes the concept of multicultural competencies in counseling? Option: the ability to speak multiple language, knowledge and skill for working with diverse population, specializing international counseling, focusing solely on radical and ethnic minorities. Answer of this question is option B, that is knowledge and skill are working with diverse population. The concept of cognitive restructuring is most closely associated with which of the therapeutic approach? Option: psychoanalytic theory therapy, person-centered therapy, cognitive behavioral therapy, gestalt therapy. Answer of this question is option C, that is cognitive behavioral therapy. Which of the following is not typically considered a core condition for effective counseling as proposed by Carl Stroger? Option: empathy, congruence, unconditional positive regard, confrontation. Answer of this question is option D, that is confrontation. The term therapeutic alliance in counseling refers to. Answer of this question is option B, that is the bond and collaborative working relationship between counselor and client. Which of the following best describes the primary focus of existential therapy? Option: changing negative thoughts patterns, exploring unconscious conflicts, addressing issues of meaning, purpose, and human existence, modify maladaptive behavior. Answer of this question is option C, that is addressing issues of meaning, purpose, and human existence. Next, the concept of trans diagnostic approach in curriculum refers to: option: diagnosing multiple disorders simultaneously, diagnosing on diagnosing uh, multiple disorder simultaneously, focusing on common processes underlying various disorder, transferring diagnosis from one professional to another, diagnosing disorder across different cultures. Answer of this question is option B, that is focusing on common processes underlying various disorders. Which of the following is not a typical ethical principle in counseling? Option autonomy, beneficence, justice, profitability. Answer of this question is option D, that is profitability. Which of the following best describes the professional understanding of counseling? Option providing advice and recommendation, a scientific process of helping individual understanding themselves, offering suggestion to solve program. Answer of this question is option B, that is a scientific progress of helping individuals understanding themselves. Counseling is considered as option an optional part of the guidance program. The least important aspect of guidance, the central and most important part of guidance program, the separate from the guidance program. Answer of this question is option C, that is the central and most important part of the guidance program. Which of the following is not correct aspect of counseling? Option remedial, preventive, developmental, prospective. Answer of this question is option D, that is prospective. I think these are already covered. Yes. Wonderful. Yes. How does counseling differ from instruction? Option. Counseling is obligatory. Instruction. I think this is covered. In the context of advice giving versus counseling, which statement is true? In counseling, the counselor makes decision for the individual. In advice giving, the individuals is responsible for the consequences. In counseling, decision making is the responsibility of counseling. In advance giving, understanding all factors is crucial for the individual. Answer of this question is option C, that is in encouraging in counseling, decision making is the responsibility of the counseling. Which principle of counseling emphasizes its universal applicability in a school setting? Option counseling is a slow process. Counseling is for all students. Counseling is based on democracy. Counseling is not advice giving. Answer of this question is option B, that is counseling is for all students. The principle of counseling is not thinking for a client but thinking with the client. Suggest that option the counselor should make decision for the client. The counselor should avoid engaging in the client thought process. The the counseling should enable the client to think judicially. The client should not think independently during counseling. Answer of this question is option C, that is the counselor should enable the client to think judicially. Which of the following is mentioned as a goal of consciousness? Option achievement of positive mental health, problem resolution, improving personal effectiveness, personality transformation. Answer of this question is option D, that is personality transformation. The goal of improving personal effectiveness, I think this is covered. Which stage of which stage of directive counseling involves predicting the future course of the counselor's problem? Analysis, synthesis, diagnostic, prognosis. Answer of this question is option D, that is prognosis. In the non-directive approach, the counselor role is best described as an active problem solver, a catalytic agent. Karlsruhe mentor, I think this is we already covered.